In this lesson, we're going to talk about white blood cells. So just a heads up, this lesson is going to be maybe a little bit longer and it's going to be more in depth, but all of these values are really important, so hang tight. So these are your normal white blood cell counts. And what we've done is we've broken up all of these cells for you. But when we're focusing on the white blood cells themselves, you're looking at 4,500 to 10,000 cells per microliter, and that's a normal value. Now, all of these values here make up what we call the differential. And the reason we call it reason it's called a differential is because they differentiate between the different types of cells. So neutrophils take up 40 to 60%, and we're going to get into all of these, so just bear with me. But neutrophils are going to take up 40 to 60% of your normal volume of white blood cells. Bands are going to be 3 to 5%. Now, these are young neutrophils. And 3 to 5% is normal, but anything greater than 8% is called a left shift, which indicates some sort of infection or inflammation. Like I said, we're going to go into that in a minute. Eosinophils are 1 to 4%, basophils are 0.5 to 1%, your lymphocytes are 20 to 40%, and your monocytes are going to be 2 to 8%. Let's break this down a little bit further so that when you see this differential for your patient, you know exactly what we're talking about. Now, remember, your white blood cells are the cells that are in the body that are responsible for responding to infection or inflammation. And they are the front lines for your patient's immunity. They're made in the bone marrow, and they are responsible for taking care of all the viruses and bacteria and potential pathogens, and they come in and break them down. So for things like vaccinations, you stimulate this immune response. And so that's an example of an immunity. Now, when you have a foreign pathogen, like bacteria, triggers a response called phagocytosis, which literally means phago, which is to eat, and cytosis is pertaining to the cells. So some of the white blood cells come in and they're responsible for recognizing those foreign invaders, and so that you actually have an immune response. And then there's the cells that go out and break all of these pathogens down. So let's get into the specifics of white blood cells. So let's talk about the different types of white blood cells that you're going to see on a differential and what they mean. So let's start with neutrophils. These are they are produced in response to inflammation. Even though they normally take up the 40 to 60% of your white blood cells, they're going to go up if you have an inflammatory response. The next one you're going to see is bands. Now, like we said on the other slide, bands are an immature neutrophil, and they're normally in that 3 to 5% range. But if you have this left shift or the indication of some sort of infection or inflammation, you're going to see something greater than 8%. The thing that you recognize is that it is called the left shift. So when you hear, hey, left shift in the bands on a differential, you understand what that means. So what it means is there's an overall stimulation by the immune system, and that's to produce more neutrophils for some sort of infection. Eosinophils and basophils are white blood cells that respond typically to inflammation. They're in much smaller numbers, but what you're going to see is, like with eosinophils, you're going to see if there's some sort of parasite. So we're looking for that parasite response. If you see an increase in the eosinophils, kind of look for maybe a parasite in the background, what's going on with the patient. The same thing with the basophils, you're going to have that increase in the basophilic response with inflammation, but this is more like an allergic response. So maybe if your patient is having some sort of anaphylactic reaction or having an asthma attack, you may see an increase in basophils in your differential. Now, when we think of white blood cells, we often think of these guys, the lymphocytes. There are several different types of lymphocytes, but they have different specific functions. And one of their main jobs is to respond to a foreign pathogen. So think vaccines. And you introduce an antigen like the vaccine, like it's in the vaccine, and the lymphocytes respond by recognizing it, and then they create these things called antibodies. And so let's use the flu vaccine as an example. So people get the flu vaccine, and if they're exposed to the flu, they've already created those antibodies, and that's what protects them. Lymphocytes are also broken up into different types of cells that destroy cells. So you have, they're called helper cells, and you have T helper cells, you have B helper cells, and then you have these things called natural killer cells. And their job is to go out and destroy those foreign pathogens. The other thing, when you look at your lymphocyte level on your differential, is that they can sometimes indicate things like lymphoma or even leukemia. The last one you're going to see on here, your monocytes. These are your macrophages. So these are the ones that go out and they're going to eat your pathogen. And their job is to engulf and destroy those foreign invaders. So if you see monocyte elevation on your white blood cell, then it can be an indication of some sort of infection. So what are some things that we should consider when we're getting these blood samples? Well, you're going to submit them in a lavender top tube, and it's got the EDTA in it, which is the anti-clotting additive. Very commonly, it's going to be submitted with your entire CBC, which is going to give you things like your red blood cells, your hemoglobin, your hematocrit, and even your platelets. The biggest thing that when you look at when you get your CBC is you're going to see if you have a differential that's going to give you a breakdown of those numbers. So you want to see if you think your patient needs a differential, talk to your provider and say, "Hey, can we get an order for the diff? Or the differential. We need to take a look and see if there's maybe some sort of indication for some sort of infection or inflammation." It's not always a standard order, so just talk to your providers about getting that. Let's talk about some abnormal lab values. So when you have an elevated white blood cell count, this is called leukocytosis, and you're going to see things like infection or inflammation. So with inflammation, maybe due to trauma or to stress or even pregnancy, all these things are going to cause an increase in those white blood cells. Typically, you're going to see this in either your neutrophils and possibly your lymphocytes, but pay attention to all of the levels in the differential. Like we talked about with the asthma or the allergic reaction, you're going to see those in maybe the eosinophils or the basophils, and probably in the neutrophils, because neutrophils are also responsive to inflammation. But it's really important to pay attention to the entire differential as a whole, and also look at your patients, see what's going on with them. So when you have a decrease in the white blood cells, this is called leukopenia. And you're going to see leukopenia with several different conditions, especially your autoimmune diseases like SLE or rheumatoid arthritis. You can also see decreases in your white blood cells with different types of cancer and even chemo and radiation. And some medications even cause a decrease in your white blood cell count. One thing that you need to be mindful of is if you notice that your patient has an abnormally low white cell count, you might see them go into what's called neutropenia precautions or neutropenic precautions. And what that means is your patient has no ability to protect themselves. They have no ability to fight off infection. And like when you or I get the common cold, our immune system automatically kicks in and it does its job. But with patients that don't have any sort of immune system or an immune response, all their white cells are gone and they can't fight off those infections. So what do? Well, you need to make sure you can put a mask on your patient. You can also put a mask on yourself. You don't want to breathe on them. You don't want to cough on them. Make sure that you wash your hands. Make sure you're using gloves. Sometimes you even have to gown up depending on like your patient load or what's going on with them. So find out what your facility's specific policy is when you have a patient under neutropenic precautions. But the thing you need to know is that neutropenic precautions tell you that your patient has no immune response. They have no protection against themselves, so you have to advocate and protect them. Our priority nursing concepts for this lesson include lab values and also infection control because we're looking at white blood cell counts. Okay, so let's recap. Your white blood cell count, normal value, is going to be 4,500 to 10,000 cells per microliter. Always pay attention to your white blood cell differential because it's going to tell you what's going on with your patient. If your patient has an elevated white blood cell count, think infection, inflammation, sort of trauma, maybe asthma or an allergic reaction. And when you have decreased white blood cell counts, you need to understand that your patient has no ability to fight off the infection. So this could be due to an autoimmune disease, cancer therapy, or even some types of medications. And when you hear neutropenic precautions, protect your patient. Do what you need to protect your patient because they can't always protect themselves at this point. So you need to be their advocate. I know that was a lot to unload, but it's really important that we went through all of it. So thanks for hanging in there. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.